the landmark reform that will finally reduce the cost of health care.
That was our president explaining how Obamacare was going to reduce the cost of health care and at the same time give everyone health insurance. It's now 6 years since the law passed. I never understood how a government mandate could give more people insurance for less money. Sounded like magic, and it hasn't happened. More people got coverage, but the costs are up so high that now some big insurance companies are dropping out of the Obamacare exchanges. Still, lots of people say Obamacare is a good thing. Dr. Bill Jordan says that. He's with a pro-Obamacare physicians group. So, costs are up.
I understand that people are still struggling with the cost of their health care, but this is a problem that started way before Obamacare. The prices have gone up over decades, and Obamacare has actually shown signs of slowing the growth of health care costs.
Well, we have a graph of that, and looking at this, I don't see any slowing of the growth. And now I'm reading that there are going to be some premium hikes of 30% and 20% next year. Plus, there's this medical device tax. How many new innovative devices do we not have? Because the device makers have been hit.
Well, let's talk about the medical device tax first. I think the real problem is that people don't have access to basic care. It's not that they don't have access to devices.
This show is about free market medicine. I think when people have a choice, that drives prices down. With Obamacare, there's less choice. Every plan is gold-plated. Even the cheapest bronze plan or whatever it is says everyone has to have free access to the morning after pill, alcohol screening, aspirin use to prevent heart disease. I mean, aspirin costs 8 cents a tablet. Why does your insurance plan have to cover this? Obesity screening.
I think a lot of people went from having no insurance to having insurance, and that was
having gold-plated Cadillac insurance.
Not many people have gold-plated insurance. It was a game changer for them. I can tell you about a woman who took care of my kid at daycare. The daycare was too small to afford health insurance for their employees. We found out that she was dropping out of working there. It turned out that unfortunately she had metastatic breast cancer, and she hadn't had insurance. She was earning too much to qualify for Medicaid, so she dropped out of the workforce so she could go on Medicaid and get treatment for her cancer. This was before Obamacare. It's really sad to see that kind of thing happen, and people now have choices. If they earn too much to be on Medicaid, they can go into the marketplace and find insurance.
They could go into a very limited Obama-dictated marketplace and buy kind of expensive insurance.
I agree with you. Still too expensive, but faced with the option of not having any insurance, I think people are overall ahead.
You support going further. You would like to see single payer like much of the world has, like Canada has. Government runs things.
I think it's a very efficient system. You get everybody into the system. There's low administrative overhead. There are a lot of advantages to it.
The government runs systems. Canada, England, people have to wait months for treatment.
Care is rationed here in the U.S. because a lot of people just don't have basic access. Their access to care is the emergency room.
But I look at these headlines in a British paper, another National Health Service horror story. Dying elderly cancer patient left screaming in pain for 9 hours. The British goal is to treat you 4 months after diagnosis. 4 months, and they're not even meeting that standard.
A lot of those problems have come with cuts over the last decade or so in the healthcare system in the UK, and that's why you get those horror stories.
Really? Because I've got this graph from the World Health Organization, and per person government health spending, I don't see cuts. The trend is up.
Right, the trend is up, but with an aging population that they have, like we have here in the U.S., the costs have been rising. So they haven't been investing as much as they need to.
Thank you, Dr. Jordan.